myxedema coma. Hypoglycemia, hypotension, and ECG evidence of hyperkalemia. 30 minutes of hypoglycemia in a patient is more dangerous than an equivalent period of hyperglycemia. Molecules that bind to a cell's receptor and trigger a response, resulting in some kind of action or biologic effect, are called agonists. Unlike the patient with hypoglycemia, the patient with severe hyperglycemia is tachypneic and hyperpneic. Which of the following clinical presentations is most consistent with thyrotoxicosis? Severe tachycardia, fever, nausea, and vomiting, and confusion. The chief clinical manifestation of Addisonian crisis is shock. The clinical presentation of a hypoglycemic patient would most likely resemble that of a patient with alcohol intoxication. The adrenal cortex produces hormones called blank, which corticosteroids regulate the body's metabolism. Unlike hypothyroidism, hyperthyroidism causes an increase in oxygen demand. Prior to administering 50% dextrose via IV push, it is most important to ensure that the IV line is patent and freely flowing. Which of the following would most likely cause Cushing syndrome? Administration of large amounts of methylprednisolone to an asthma patient. Which of the following interventions would the paramedic least likely perform on a patient with diabetic ketoacidosis? Insulin administration. A decrease in adrenal hormone production will result in all of the following, except hypertension, administer a second dose of dextrose, and prepare for immediate transport. Administer a second dose of dextrose, and prepare for immediate transport. You are dispatched to the residence of a 60-year-old woman who was found unresponsive by her husband. As you are assessing the patient, her husband tells you that she is a diabetic and has recently experienced several small strokes. In addition to properly managing her airway, you should perform a field glucose test to rule out hypoglycemia. Which of the following is an example of endocrine regulation via a negative feedback mechanism? The neural regulating mechanism decreases its signals to the adrenal medulla, decreasing epinephrine release. The adrenal medulla secretes norepinephrine following stimulation from the hypothalamus. Which of the following would not cause hypoglycemia in the patient with type 1 diabetes? Insulin underdose. Insulin resistance occurs when the pancreas produces enough insulin, but the body cannot utilize it effectively. A 29-year-old man presents with bizarre behavior and profuse sweating. His wife tells you that he has type 1 diabetes, and that he took his insulin today. During your assessment, you will most likely find that the patient is tachypneic. A patient with Cushing syndrome would most likely present with hypoglycemia. The primary role of cortisol is to assist with the body's response to stress. A person with type 1 diabetes generally does not produce any insulin and requires daily insulin injections. The tissues of the central nervous system depend entirely on glucose as their source of energy. What is the function of estrogen? It signals the anterior pituitary gland to secrete luteinizing hormone. Diabetic patients would most likely present with atypical signs and symptoms of acute coronary syndrome. Microvascular complications of diabetes include all of the following: except hypertension. Which of the following statements regarding insulin is correct? Insulin is the only hormone that decreases blood glucose levels. The endocrine component of the pancreas comprises the islets of Langerhans. Adrenal insufficiency is characterized by decreased function of the blank and consequent underproduction of blank. Adrenal cortex, cortisol and aldosterone. If there is a physiologic level of antidiuretic hormone in the bloodstream, then the renal tubules are stimulated to reabsorb sodium and water. Hyperglycemia is characterized by a gradual onset and warm, dry skin. Secretion of the parathyroid hormone is regulated by blood levels of calcium. Excessive alcohol consumption can lead to low blood glucose levels because alcohol depletes glycogen stores in the liver. Experiencing hyperosmolar non-ketotic coma. Diabetic ketoacidosis occurs when the cells metabolize fat and produce ketones. Crystalloid fluid hydration. Type 1 diabetes that is secondary to an autoimmune disorder occurs when the body builds up antibodies that destroy the islets of Langerhans. Unlike exocrine glands, endocrine glands release chemicals directly into the bloodstream. Administer a second dose of dextrose and prepare for immediate transport. You are assessing a 70-year-old man with a blood glucose reading of 400 mg per deciliter and note the presence of sharply peaked T waves on the cardiac monitor. Which of the following medications would this patient most likely receive in the pre-hospital setting? Bicarbonate. Which of the following is/are not an exocrine gland? Adrenal glands. When the body's metabolic rate decreases, The thyroid gland secretes thyroxine. A person with type 1 diabetes generally does not produce any insulin and requires daily insulin injections. The primary anatomic link between the endocrine system and the nervous system is/are the hypothalamus. Patients with hyperosmolar hyperglycemic non-ketotic coma present with severe dehydration and neurologic deficits. The endocrine system comprises a network of blank that produce and secrete chemical messengers called blank glands, hormones. Common symptoms of type 2 diabetes include all of the following: except dysuria. Diabetes is most accurately defined as a metabolic disorder in which the body's ability to metabolize simple carbohydrates is impaired. The posterior lobe of the pituitary gland secretes antidiuretic hormone and oxytocin. The most common cause of Addisonian crisis is abrupt termination of corticosteroid use. Experiencing hyperosmolar non-ketotic coma. When the pancreas does not produce enough insulin or the cells do not respond to the effects of the insulin that is produced. Glucose levels in the blood and urine will be elevated. The release of glucagon into the bloodstream stimulates the liver to convert glycogen to glucose. If the body experiences a drop in volume or blood pressure, aldosterone secretion stimulates the kidneys to reabsorb sodium from the urine. Which of the following statements regarding Addison disease is most correct? Addison disease most often occurs when the immune system creates antibodies that attack and destroy the adrenal cortex. A patient with diabetic ketoacidosis experiences polydipsia as a result of dehydration. An illness or infection would most likely cause a slow onset of hyperglycemia. In contrast to primary adrenal insufficiency, secondary adrenal insufficiency is caused by decreased cortisol secretion secondary to a lack of adrenocorticotropic hormone secretion from the pituitary gland. Pre-hospital treatment for patients with hyperosmolar hyperglycemic non-ketotic coma focuses on airway management and fluid rehydration. Severe dehydration that commonly accompanies diabetic ketoacidosis is caused by hyperglycemia-induced osmotic diuresis and vomiting. Signs and symptoms of hypothyroidism include bradycardia and sluggish reflexes. Hypoglycemia, hypotension, and ECG evidence.